tonight. I'm really excited to have this important discussion and hopefully a critical discussion, and appreciate anybody who did participate in that Indy Hub survey to really elevate this issue of homelessness on the public agenda. So I'm Chelsea Haring-Cozzi. I'm the Executive Director of CHIP. CHIP stands for the Coalition for Homelessness Intervention and Prevention. And I'll tell you a little bit about CHIP in a few minutes, but I want to make sure to first introduce the rest of the panelists and the folks you'll be hearing from tonight. So I'll go in order of who's sitting next to me and down. And I will start with Andy Beck, who's right here next to me. Andy serves in a lot of different roles and wears lots of different hats. Andy is the manager right now of the city's Tenant Advocate program that really launched during COVID to really help provide information, advocacy, and inform tenants of their rights to prevent housing loss, particularly during the pandemic. Andy and his wife, Lauren, have lived in the Near East Side neighborhood Cottage Home for 16 years. They have 2 sons and enjoy biking around downtown and going to the boys' soccer games. He previously worked with the Kepra Institute as the Community Land Trust Coordinator under their program that he co-founded, Homes for All Indy. Andy is passionate about community development. He's a practitioner and really formalized that role in 2020 when he got his Master's of Urban Design degree from Ball State College of Architecture and Planning. Again, Andy wears a lot of different hats. The most recent, I think that you'll talk a little bit about, is the work he's doing to really help prevent evictions in response to the pandemic, and really part of a more upstream effort to prevent people from slipping into homelessness. Next to Andy is Lauren Rodriguez. Lauren serves as the Director of the Office of Public Health and Safety with the City of Indianapolis. This is an agency directed by Mayor Joe Hogsett to promote the health, safety, and well-being of Indianapolis residents. In her role, she champions housing and homelessness issues, re-entry services for those coming out of incarceration, and food policy and nutrition, and effective violence reduction strategies. Lauren joined OPHS from Hall, Render, Killian, Heath, and Lyman, PC, one of the nation's, that's a mouthful, one of the nation's preeminent health law firms. She previously worked in civil litigation for the Office of the Indiana Attorney General, and before that, she worked as a Marion County public defender. Lauren serves on the Eskenazi Health Center Board of Directors and has been involved with Big Brothers Big Sisters of Central Indiana for over 3 years. She holds a JD from the St. Louis University School of Law, where she specialized in healthcare law. Thanks for being here. And then Lillian Herbers-Kelly, who's at the end here, is Director of Housing at Horizon House, one of our largest supportive housing providers, newest supportive housing providers here in Indianapolis. And Horizon House is an organization that has been in Indy for a long time doing a lot of work around homelessness. Lillian runs essentially the supportive housing program at Horizon House here in Indianapolis. She's responsible for providing oversight for the housing team, which includes housing navigators, intensive housing case managers, and their supervisors. She establishes and maintains relationships with community providers, as well as being responsible for the data collection for her team. Her educational background is in social work, having earned a bachelor's and a master's degree from IUPUI. She's worked with various housing programs for the past 10 years, both in direct services as a case manager and as a supervisor to a multidisciplinary team of staff. Lillian has a passion for housing and ensuring services are delivered with a housing-first, strengths-based harm reduction framework. So these are some of the experts that you're going to hear from tonight as we talk about homelessness here in Indianapolis. So with that, I'm going to do a little framing before we get into the discussion questions. I'm going to start by talking a little bit about CHIP's role in all of this and how CHIP is part of this collective effort. CHIP is a small nonprofit here in Indianapolis, and we're only Indianapolis-based. And our role is to support a community-wide collective impact approach to ending homelessness in Indianapolis. We serve as what's called the Continuum of Care, which is a network of agencies and community leaders and stakeholders working collectively to end homelessness. We support the Continuum of Care and serve as the COC, is the acronym, lead agency. We are the Homeless Management Information System lead agency, so we're kind of the data hub that looks at how many people experience homelessness over time, how that changes, how are we doing as a community. And we're the coordinated entry system lead. And coordinated entry is the way in which people who really need access to a housing intervention are assessed and then connected with that housing intervention that's going to meet their needs and resolve their homelessness. It's a way to try to do it in a more equitable, fair way that prioritizes vulnerability. We are a strategic planning organization, a project management, and a data-driven organization. We do not do direct service. CHIP doesn't. I think that's an important distinction. We rely on organizations like Horizon House to really be implementing the strategies. But we do firmly believe and support work that is based on housing as a human right. We firmly believe everyone deserves to be housed and connected to quality care. And we're committed to advancing housing choices and housing solutions. While those experiencing homelessness are our motivators and our inspiration, we really serve the homeless service sector to make sure that we're working together in an aligned way, a collaborative way, and making sure that we're all working towards the same kinds of solutions. So with that, let's talk a little bit about homelessness and frame tonight's discussion. And hopefully this speaks to some of the issues that you raised in your survey. The first thing I want to just note, and I hope you really hear this, homelessness is the result of broken systems and bad policy decisions. It is not the result of broken people or personal flaws. Homelessness is a systemic problem, and it's a housing problem. Why is that important to note? Because it's going to require systemic change and housing to solve it. And a lot of what we might talk about are things that are done to kind of manage, to have some short-term solutions, but the way we really solve it, and you'll hear this from some of our panelists, is through permanent housing. It is not a public safety issue, nor a public health problem, but it has implications for both. And I think that's important to note as well. There's a lot of talk that happens about homelessness as a public safety issue, and this will be important, and I'm sure Lauren can speak to some of this. Homelessness is not something that's going to be solved by law enforcement or a law enforcement response. They can be key partners in this work for sure, but homelessness really is something that has to be addressed through housing solutions in partnership with those working in public health and public safety. I'm going to read a couple quotes from a really interesting article that came out of Huffington Post that talked about why cities can't solve homelessness. Homelessness, and part of it's a misunderstanding about it, but homelessness is no longer a symbol of decline in communities. It's not happening in communities that are on the decline or the downward trend. It's actually a product of prosperity. The vast majority of people being pushed out of housing are those who simply need higher incomes and lower housing costs. But they're living in cities where housing costs are going up and the kinds of jobs available aren't accessible to them. So this has been a big challenge in cities where jobs are going high tech and going to more skilled, advanced industries, requiring more education and more certification, and where housing has been developed to meet those higher wage jobs. So I want you to kind of think about that as we talk tonight, that homelessness is not happening in cities, and you're not seeing the rise in cities that are on the decline. You're seeing them in cities that are really on the uptick and bringing a lot more tech to the tech firms and agribusiness and those kinds of things, and then bringing housing to meet those high wage jobs. Cities that have seen spikes or increases in homelessness coincide with booming tech sectors and falling unemployment. So when we look at some of the reasons people become homeless, and there are many of are systematic. Overcriminalization of drug crimes and mental health issues, rising healthcare costs and rising housing costs where wages aren't keeping up, and really hard to navigate resources and safety nets. We don't always make it easy for people to access resources. So let's talk about the context of all of this. So there's some data I want to share from the National Low Income Housing Coalition on a study they did called Out of Reach, and this is from 2021. The they looked at states all across the country and cities within those states and said, what would you have to make to really afford housing in those places? The hourly wage required to afford a 2-bedroom rental in the state of Indiana is over $16 an hour. $16.57 to be exact. In Indianapolis, it's $18.19. Now compare that to our current minimum wage in the state of $7.25 and the average renter wage here in Indianapolis of $14.58. So there's a gap between housing costs and average wages, and that's happening all across the country. There's a report that comes out of United Way called ALICE. It's called Asset Limited Income Constrained Employed. These are people who are working just above that poverty line, but more and more or less and less able to afford the basic necessities. And the ALICE report found that 65% of jobs in Indiana pay less than $20 an hour. The ALICE population is rising. 47% of households in Marion County are below the ALICE threshold. 49% of those in Marion County are what are considered rent burden, meaning they're paying more than 30% of their income to rent. And 26% on top of that are severely rent burdened, meaning they're paying more than 50% of their income to rent. So any kind of job loss or shift in wages can severely impact that housing. So how does that impact homelessness? There's not a direct linear path to homelessness, but these things contribute. So looking nationally at homelessness, the state of homelessness, and this is based on what's called point-in-time count data. It's a single night census that cities across the country take to understand homelessness, and then it's aggregated at the national level. On a single night in this country, over 600,000 people, one night, are experiencing literal homelessness. That doesn't mean they're couch surfing, that doesn't mean they're doubled up. They are literally homeless in emergency shelters or living on the streets. A vast majority are individuals, a vast majority are men. People in families with children, though, make up the next largest population and are on the rise. Black individuals and households are disproportionately represented among those experiencing homelessness, and on the national level make up for 40% of those experiencing homelessness. A majority, 61%, are staying in shelters, but unsheltered homelessness continues to become a growing challenge, particularly in response to COVID. Unsheltered homelessness is experienced primarily by those who are chronically homeless, meaning they've been homeless for long periods of time, multiple episodes, and have several disabling conditions, health conditions, maybe a mental health issue, and unaccompanied youth. Homelessness overall has trended down since 2007, but more recently has upticked, particularly in terms of those living unsheltered and those experiencing chronic homelessness. So what does that look like here in Indianapolis compared to the national context? Well, on a single night here in Indy, and this is 2021 data, we're finishing up this year's data, 2022. On a single night here in Indianapolis, 1,928 people were experiencing literal homelessness. That's up from previous years, but if you look trend-wise, we've been pretty flat for the past 10 years, anywhere from 1,500 to 1,900 people on a single night. A vast majority are male here in Indianapolis too, but people in families with children are increasing, and you will see that and hear that from our family shelters. Black individuals are even more disproportionately represented in Indianapolis. 54% of those experiencing homelessness in this city are Black. We're also seeing a growing aging population of people experiencing homelessness. Here in Indy, we do have some large shelter providers. 86% of those experiencing homelessness are in shelter, with 14% living unsheltered, and that is up. It's the highest it's been, but we also changed the methodology to try to capture more people this past year during COVID. What does it look like over the course of a year? That was a single night. In 2021, there were 7,437 individuals who engaged with our homeless system, meaning they showed up in shelter, on the streets, engaged with street outreach teams, or were in safe haven or transitional housing. The inflow into homelessness was greater than the outflow into housing. That's a problem. You want inflow to be less. You want to be housing people at a rate that there's a quick pathway back to housing. There were 1,300 individuals housed through the coordinated entry system, meaning matched with a housing intervention that we have funding for in this community, and we'll talk a little about that funding. And what that means is when they're matched to housing, they're being connected to and supported by a specific housing intervention, either permanent supportive housing or rapid rehousing to assist in resolving their homelessness. That means there's some type of rental assistance support that comes, and ideally very high quality intensive case management and services offered and available. So that's a little bit of a snapshot and framing of homelessness that we'll get much more into with our panelists. A couple challenges and opportunities in front of us that you'll hear more about. Indianapolis does have a robust strategic community plan to address these issues. We have 6 strategic priorities in that plan. It was launched mid-2018. We're in the midst of working through that plan and aligning resources to that plan. It's a good plan, but there's still a lot of work to do. The plan is based on the belief and vision that everyone deserves housing and quality care. And the goal when we say we want to end homelessness means this, and this is important too. It is not that somebody won't experience a housing crisis that may result in a shelter stay or an unsheltered experience. What it means, though, is that there is a system and a response and resources in place to make sure it's rare, meaning that's not the first place people end up when there's a housing crisis. That it's brief, meaning people don't spend a long time in shelters or on the streets. And that it's non-reoccurring, that once they're back in housing, they stay in housing and don't come back to homelessness. That's the goal. Indianapolis has some real great things working for us. We have continued to increase funding earmarked for homelessness year over year, including the recent announcement, if you heard yesterday, the recent announcement of $9.4 million in HUD Continuum of Care funding coming to the city. That is double what the city was getting just 6 years ago. That's good. That resources continue to come to support this work. What we have to do is continue leveraging and bringing those resources to the table and making sure they're making an impact and they're going to the places that are performing well. The funding supports rental assistance, housing subsidies, and services. As you'll hear tonight, funding is only one component though. Money cannot solve everything. We also need good partnerships. We need high-performing partners. We need units, housing units. We need landlords. They're a key part of this too. And we need to really look at some of our tenant rights practices and policies and the way in which housing can be accessed by people. We also have a talent gap. You will see up here, we are a predominantly white panel, and this is indicative of our sector. It is not reflective of the people being served, and we are not getting enough talent into our sector to do this work. We have a unit shortage, and we face a lot of barriers to accessing quality housing for folks. So with that, I'm going to let the experts dive a little deeper into some of these issues. So I'm going to ask a series of questions. Some are just open to the panel. Anyone can jump in. Some are a little more targeted based on your areas of expertise. Let's start with some of the data I just shared. The point-in-time count this last year did find that almost 2,000 people here in Marion County were experiencing homelessness, and it is the highest count we've had in a decade. More than half of those, as I mentioned, are Black households. What, from your perspective, accounts for this uptick? And can you speak to how your organization or your office is working to address some of these challenges?
Is this on? Yeah.
Yeah.
Hi, everyone. So Chelsea, from my perspective, nailed the reasons for the uptick. There's systemic challenges, so I'm not going to belabor the point on that. It's not a lack of effort on folks' end. It's failures in our system. So one thing, though, that I think has really impacted us the past several years is, that thing called COVID that's been happening. It has really done a number on just our society, I think, as a whole, and just made us fairly unwell. And I'm speaking from just what I've seen anecdotally. Chelsea touched on the disparities in arrests and convictions amongst Black and Brown folks. And I just want to say that one of the things we're doing at Horizon House to address that is we have a partnership with Marion County Prosecutor's Office, particularly the Quality of Life program, that the whole point is to divert folks from criminal charges. We have a grant from the Vera Institute Motion for Justice program that their whole point is reducing disparities in the legal system. So because we see so many people coming out of incarceration or being arrested because of being homeless and the things that kind of go along with that, just as an example, housed folks generally don't get public intox. And, we have an open carry alcohol here in Marion County, but you don't often see people not homeless being arrested for things like that. So those kinds of things are really important for us to address. People shouldn't have additional charges for because they are unhoused. So that's one thing that Horizon House in particular is trying to just address. Another thing I just want to mention about the number of folks increasing, and just pure number, is we need more units because we have more people. So Horizon House is working on getting some more units, which means building. So we have a project coming called Compass on Washington that I'm really excited about. It's going to be 36 units for single folks who are chronic. So what Chelsea was mentioning, meaning they have high vulnerability and have been homeless a long time and maybe have been placed into housing and then have been unsuccessful in that housing. So hopefully we can, as a system, add more units, not just landlords, but physical units that we're in charge of that can hopefully be more successful. So I'm excited about that. That's all I have to say for that one.
I saw a hand up. Is it okay if we do discussion?
What's up?
Yeah, so there's a couple issues here. One, the overall number of people experiencing homelessness on that single night has increased. And so what are we talking about the uptick? Within that, there continues to be racial disparity in who's experiencing homelessness. We've actually not seen the disparity increase. It's been pretty significant for years. So I think it's unpacking both of those issues of why are we seeing the uptick in the homeless point in time count, and then what do we attribute some of the racial disparities to, and how are we working to actively name and address those? And so I think one of the things that Lillian touched on is we have an overrepresentation of Black individuals and households experiencing homelessness. That is also reflected in the overcriminalization and the criminal justice system. You have significant racial disparities in the criminal justice system. And there is a connection and intersection with criminal justice involvement and homelessness on kind of two fronts. So we have people who have served in the Department of Corrections that are being released into homelessness, that are being dropped off at emergency shelters, and that then as soon as they hit that shelter door are experiencing homelessness. And the path back into housing is challenging because if they have a criminal history, the way tenant screening practices work, they are screened out of a lot of housing. And that is disproportionately affecting Black and Brown individuals. On the flip side, you have people who are experiencing homelessness who are also having higher rates of justice involvement for what Lillian kind of mentioned, what are considered like nuisance crimes or homeless crimes, things that are only happening because somebody has no home to go to, public urination, public intoxication, loitering, things like that. And so, again, when you think people are disproportionately experiencing homelessness who are Black and brown, there's also then disproportionate interaction with the justice system. Horizon House has some great programs or interventions that they're doing to try to address some of those disparities. And Lauren, I don't know if you want to jump in. I know the Office of Public Health and Safety is also doing a lot around diversion, criminal justice diversion, specifically to address some of these challenges.
Yeah, so I'm going to answer the question separately. Why do I think it's increasing now? And I agree. It's definitely COVID is one of the huge factors, right? People couldn't go to work because they're home with their kids, right? Or they just got laid off from their jobs. And so if you can't go to work and you don't have a job, and then you can't pay for rent anymore, what are you going to do? So I think that's one of the main issues that have caused the numbers to increase. Now, the Black and brown specific statistics, I'm coming at it in a different, unique perspective than everybody else here. Because I served as a public defender for almost 2 years in Marion County, a lot of my clients were homeless or at risk of being homeless, and a lot of the crimes that I dealt with were those nuisance crimes. And I will say that OPHS and this administration, the City County Council, and all these organizations that are working together are seeing the disparity there, but also recognizing, like Chelsea mentioned in her opening, we need more Black and brown representation to advocate for those individuals, not only because we provide a unique perspective, but because we're also trying to build trust, right? So part of what my office does is we go out into the community and we have to develop that rapport with them first. Before we can offer services or connection to services, they need to know that they can trust us. And everybody has touched on how the system is broken. So you have to realize that these individuals recognize the system has been broken for a long time. So before you can just say, hey, I'm going to come in and I'm going to fix all your problems, I'm going to give you a house and you're going to be A-okay, you need to make sure that they trust you to even take you up on those services. So OPHS has done a lot out in the community with the help of organizations and partnerships here in the city. The AIC is one of the big things, right? A lot of my clients as a public defender, a lot of them suffer from mental health and or substance use issues. A lot of them also didn't recognize that. And there is and I could go on all night, and I'm not going to, of why that's the case. A lot of the Black and brown community, especially the community that I grew up, I'm Hispanic, we didn't talk about mental health. We didn't talk about substance use. We are the ones that we've already been told that we're less than, right? So hide all of the other issues, right? We don't want to highlight for everybody else what our issues are at home. And so then you don't talk about it, then you don't deal with it, right? And then that goes on generation after generation. So that's one of the barriers we're trying to break down. We're working really closely with IMPD. There's a great our homeless unit led by Lieutenant McElmore and Sergeant Dardine, and they are partnering with us, also with MCAT, the Mobile Crisis Assessment Team, to help address these issues and realize that we don't want to come and arrest you and take you into jail, because that's not where you're going to get help, right? So they actually go out there and they develop the rapport and the trust of the community members, and they then figure out, okay, now that you trust me, let me connect you with emergency housing or with longer term care and Horizon House. And so I think that's part of the issue. I can't tell you every single reason why these numbers have upticked and why our communities of color are disproportionately affected. But I will tell you that there are people out there that are really championing this and seeing this. And I'm hoping to get more partnerships out in the community, especially Black and brown representation, to help build that trust for our community to take up on these services and be able to listen to us and see that these services are there for them.
Andy, anything you want to jump in there on?
On the uptick side, I'm working in eviction courts right now. So we cover 8 courts. My team covers 8 eviction courts of the 9 because we have the township system. So some of those courts have 100 eviction hearings a day. So that speaks to the uptick, speaks to the lack of income through COVID. It also speaks to the incredibly expensive rents in Indianapolis. There's a common refrain that you'll hear that Indianapolis is an inexpensive place to live, and I will debate that every time I see it. It's inexpensive for me. It's inexpensive for rich people, but for lower middle class and lower income folks, it's extremely expensive. Rents are outrageous, and I have a couple good friends that live over here in the Unwa neighborhood, and there's some single room kind of slumlord type houses. They're getting $1,200 a room for like an efficiency. Oops, I'm gonna drop all my stuff. So that's not a luxury, efficiency downtown by where I live. It's in kind of a medium desirable neighborhood, and terrible conditions. So we're lacking in supply of affordable housing. We're lacking in supply of affordable rental housing, and some of the affordable housing that we produce, it eclipses and turns into market rate. So we're losing affordable housing units consistently year after year, just through the arrangements of the development financing and how those arrangements eclipse. So that's the reasons for the uptick that I see kind of on the supply side.
Question. So there are different kinds of housing for people experiencing homelessness. A lot of agencies have scattered site, which means they have the money, they need to find a unit and put the person in that unit. So that's anywhere. And then CHIP, has all the data, and we see that there's a need for additional units. And different agencies, like right now, Horizon House is going through the Corporation for Supportive Housing Institute, which is a whole series of kind of figuring out who you're going to serve, who's your builder, developer, so partners come into it. So yeah, there's the city of Indianapolis, CHIP, all looks at how many people are coming into the system and what units do we need to build to kind of serve that need. So it really just depends on who has the appetite to try to get a developer, get a property manager, and partner and apply for tax credits. And I don't know all of those things, so I won't even speak to that. But the city of Indianapolis is really looking at trying to make more units that are specific and set aside for people experiencing homelessness.
Go for it.
Right now, so Chelsea mentioned the coordinated entry system. There's a housing assessment. It is currently, we're using something called the VI SPDAT. It's a vulnerability index. It goes through health issues, ER visits. Has the person been kind of harmed in the community? Just a ton of questions about their ability to either take on housing quickly, get income quickly, take it on themselves, or are they someone that needs ongoing support from a program? So it will depend on that score and kind of the length of time they've been homeless, and we really prioritize people who've been homeless a really long time and have high vulnerability for those units specifically.
Yeah. And just to piggyback, it's both and, right? So there is a specific type of housing that Lillian just talked about called supportive housing. And it can be project-based, meaning you have units all in one building, or it can be scattered site, meaning it's all across the community in different parts of the community. When we talk units, we're talking about apartment rentals, right? It's not a special, we have our own language sometimes, so flag us, right? And supportive housing is really, as Lillian mentioned, those with the highest vulnerability that are going to probably need a longer term rental subsidy, typically in the form of a housing voucher that can stay with them, and more intensive services. But for others experiencing homelessness, it may just be they need a little assistance to get back on their feet, but not long term. They need a little bit of a rental assistance, maybe 3 months, maybe 6 months, and help finding an apartment that they can afford and that they can take on longer term, that's close to transportation. And we don't have enough of that either. So when we talk about more units, we need to, one, find the units that exist, apartments that exist in Indy that are willing to work with these programs. Because you do have landlords sometimes that say, I don't want to work with rental assistance programs. I don't want to work with a housing voucher. So the first lift is, how do we engage landlords more and explain to them like what we're trying to do and what these programs are and get them to work with us. And so it's maximizing the units that are there, that are out in the city. The second part is there's just not enough. So there's not enough supportive housing units, and the city is working on a pipeline of bringing 471 more units of supportive housing over the next 3 years, but it's also just affordable housing. There's not enough affordable housing. So it's a both and.
What OPHS is doing, we are forming partnerships right now. And it's not just reentry with adults right now, it's also reentry with young individuals. I will tell you, we are finding gaps in the system, and we are trying with the ARPA funds, the American Rescue Plan, with their funds to help with this situation. However, this is going to take a collective effort, and I know Chelsea is definitely digging in and helping us figure this out. Chip is helping us figure it out, but I will say that right now the community justice campus that's opened up, not fully, but started to open up, this is the first time ever where we're having re-entry individuals that are housing certified located in the re-entry space. So the jail, the way it is set up now, in order for the individuals to exit, they have to go through this space. And this space will have reentry specialists 24 hours a day, 7 days a week. And we are engaging with them to get them not only housing, but jobs, and if they want to go to education, just any services that they may need, food. And so once the CJC fully opens and we're fully staffed, we are going to be able to also work with the sheriff's office and figure out those individuals that are 30, 60, 90 days out and what their needs are to start addressing these issues before they even leave, right? It's hard, and I tell people all the time, when I was a public defender, the worst time to try to talk to my client was after they left, about probably a week after they left, because I can't find them. Because they won't stay in the jail, and who wants to stay in the jail after they've served a sentence or are there for a few days. So the fact that we get to start to engage them while they're still in custody is really beneficial and is going to be really helpful, and I'm really excited about that. But getting people who are housing certified to understand what you need to do to sign people up. And then we're also helping with, the prosecutor's office is helping us, and IMPD is helping us. If they've seen somebody in the quality of life division, like you mentioned, Lillian, that they know is in custody because they got arrested for something else other than one of those nuisance crimes, they're constantly reporting to OPHS, okay, here's that. Then we can help with Wheeler. We can go to our partners with Horizon House and get them situated and get them in the housing pipeline. So it's a collective effort. By all means, it's not a blanket fix or cure all, but it's a step in the right direction. And just a FYI, we have announced $15 million that is given through the Indianapolis Foundation to go to grants. Part of the overall crime prevention model, crime reduction model. As Chelsea stated, homelessness and housing is not part of a public safety issue, but that can overlap, right? And so the supportive and preventive services and the unique services out there is what these dollars are going towards, and it's going to be $15 million this year, next year, and the year after. So please, if you need the link, I can give it to you guys at the end.
And just a quick piggyback, there's a lot happening in Marion County to engage and to, again, divert people from the beginning to that arrest or to serve any time, particularly for some of these things that Lauren's talked about. But the other part is really developing a robust relationship with the Department of Corrections. because they have the ability to do a lot more pre-release work and diversion work and trying to connect people with housing before release. They were able to demonstrate that during COVID when we essentially said, you cannot send people to shelters right now during a public health crisis. We're trying to reduce our shelter populations so people can stay safe and healthy. We can't have people being released to shelters. And they were able to reduce their releases to shelters by 50% during COVID. So it's possible with good partnerships and relationships with these other systems to have them, kind of be part of the solution. And so I would just add to that, a lot of this work is about relationships and getting the right people to the table to say, what are you going to do? What's your part in this? And that's a big part. So let's talk a little bit about, and I'll keep looking for questions. Let's talk about, we've talked a lot about housing so far and the need for housing, both in terms of what's here and more housing to be developed and protected. Andy, I'm going to kick it to you for a minute. So let's talk about the existing housing situation. There's a lot happening in Indy in terms of neighborhood redevelopment. I've been watching some of the prices and the condos coming up downtown and what's happening. Our office is over in Fountain Square. I look at housing prices. I'm like, wow, that's $400,000, $600,000 here in Indy. What's happening? Can you talk a little bit about the effect or role that gentrification is playing here in terms of creating an inclusive, kind of balanced housing market? And what needs to be done to protect some of those affordable spaces?
Sure. Hope I have 2 hours to go on a very long rant here. Housing costs are up and up. I just said a few minutes ago, rents are up and up. Housing prices are up and up. Some of my realtor friends have asked me about kind of that mid-level of, your average qualifying homeowner that has good credit, can qualify for a mortgage. They can't find a house because the house is gone. They can't wait on the financing because there's a cash offer and it's for more than asking price. So there's they're experiencing a piece of the housing crisis. But yeah, everything is up and up. Houses in my neighborhood are being built for $800,000. I mean, there's no way that I can sell and move back. So I'm staying till I die. But, we talk about policies. One of my other projects I've been working on for several years with Homes for All Indy is a citywide community land trust. We're excited that the city has included in their budget in 2022 startup and operations for that project. That project is going to hold affordable housing and make it permanently affordable. So instead of kind of the standard, we build a house that's affordable for 5 years, and then you can sell it to the market and you can cash out. That's great for that person, but that kind of hurts the rest of the neighborhood, right? That raises housing prices and people are getting squeezed out. It's the historic forced migration of the poor. When wealthier people want a space, they colonize it and they take it, and the poor have to go live somewhere else. So trying to shift some of the policies and actions that some of the methods that we've been using for development for the last 400 years in this country, I think we need to revisit those and change those. They don't seem to be working. We're at a crisis. I think we've gone past the crisis. My experience in the eviction courts, I started using the word disaster. It's pretty bad out there for a lot of people. So some of those changes, I think the housing market forces economic segregation. If you go neighborhood by neighborhood, there's not a $1 million house next to a $150,000 house. The market does not allow that to happen. So that's hopefully the Community Land Trust Project takes homes off of the market and keeps them where they're at. which allows the market to do its thing. It's not a complete takeover, but the market can exist and keep doing its thing while we can preserve our scarce subsidies as housing and use our housing subsidies to support the basic human right of safe, affordable housing instead of using our housing subsidies as a wealth creation exercise.
It ebbs and flows over time, right? Because economics change in cities and policies change, but there are several cities we've paid attention to. So Houston, Texas has done a lot of really significant work in reducing homelessness with a very collaborative effort with their city, their mayor's office, bringing more affordability, more vouchers, housing vouchers to the system. For a long time, Salt Lake City was doing significant work and making a ton of progress on reducing homelessness through, again, really targeted city investments and collaborative work. We've been watching them a little bit. We talk a lot with our peers like in Cincinnati and Chicago and Atlanta. The last 2 years have really kind of flipped everything upside down everywhere. So there are some good examples out there, and I really hope there's opportunity we can share some resources after this for those that want to dig in more. We pay attention to the cities that are really making investments in the longer term housing solutions. I know there's a lot of attention. I know folks from Indianapolis through the Indy Chamber have taken trips to other cities, San Antonio being one, to look at some shelter solutions. Maybe we can talk a little bit about that. When you're talking about homelessness and a homeless response system, there are different components to it. There's the crisis response part, right? Somebody loses housing, they have no network, they have no safety net, they end up needing shelter. There has to be good crisis response available, right? There have to be shelters available that are inclusive, that are low barrier, that provide safe places for people to come in. Indy has great shelter partners, but we don't have low barrier shelters. We don't have shelters that are inclusive of everyone. So there's a lot of talk of how do we improve that? How do we make sure there are safe places for those in crisis to come in when they need it, and then have that be a pathway to housing, not a destination. I want to be clear, shelters don't solve homelessness. Shelters should not be destinations. They should be a safe place to land while you get back connected to housing, and they should be inclusive. So it shouldn't matter who you are. It shouldn't matter how you identify. It shouldn't matter if you are a substance user. You should be able to go into shelter in that crisis situation. And there's a lot of work being done to look at where are the gaps here in Indianapolis in terms of that. But that's not a solution. There are cities doing that well that we're learning from. But the cities that we are paying attention to, again, are the ones that are doing the long-term investing, looking at pipeline, developing more units, continuing to invest in those units. And again, Houston and Salt Lake City are two that, previous to the pandemic, we're doing some good work there. Sure, I'm probably going to look to Lauren and Lillian to talk about this, both from the perspective, the housing project that Lillian mentioned is not far from downtown. And then in terms of the downtown spaces, you've probably been involved in a lot of those conversations. Our largest shelter is located right downtown. Wheeler Mission is in the heart of downtown for the most part. And I think you're hitting the nail on the head. I mean, people need to be close to resources. During COVID, the city, we set up a lot of hotels, and the collective CHIP didn't do this on our own. We did it together, but there were a lot of hotels set up to serve as kind of temporary shelters during COVID, and they were out by the airport. It was hugely problematic because there was no transportation out there. People were very disconnected from resources. Thankfully, we had great service providers that were going out there and bringing services to people, and shuttles got set up, but being close in proximity is important. So do you want to talk about what conversations have been happening and kind of, Lillian, what you may have faced as you guys were talking about location of supportive housing?
Yeah, so some of the property you will find actually is privately owned in the downtown area and surrounding areas. So we, with the help of our partners, have been trying to locate those property owners, but sometimes it's really hard to find them. Because a lot of the times they're not here in Indiana. Mm-hmm. So with that being said, we can't do anything if if it's a private owned property. But we have been looking at other areas. I don't know if you're familiar with the low barrier shelter study that Indianapolis did, as well as the state of Indiana. And so it's looking at what Chelsea was saying, getting them not only into emergency care, but getting them in the pipeline to not be homeless any longer. Now, what the low barrier shelter study revealed in Indianapolis is that Indianapolis needs a low barrier shelter. And like you said, it needs to be close to resources. So right now we got through the Marion County specific study. We're waiting on the state to finish their own study. But we're in the midst of looking at, okay, where would it be the best place? What I will tell you is, and the mayor mentioned this the other day in the press breakfast, is there's a lot of support for it, except for when it comes to their neighborhood. Mm-hmm. So with that being said, right, of course we all want a low barrier shelter, but the issue is where. And so we've been looking at that, given the fact that Indianapolis does need a low barrier shelter. And the low barrier shelter model is more along the lines of not only emergency beds, but long-term beds to get them in the housing pipeline. It takes a while for them to get into permanent housing. So making sure that there's a place for those individuals who are already signed up. And that way we don't lose them, right? Because we've been finding that if we can't get a hold of you and you're next in line, then they will move on. And so we're trying to address that issue, but also then Chelsea mentioned something wonderful. The Crown was an interesting test subject during COVID, where we were able to house a lot of individuals at the Crown Plaza down at the airport, but it was difficult with transportation. And so we were very thankful for our partners to go out there and help those individuals, Aspire especially, getting them connected to resources. And it shows that a low barrier shelter is feasible here and that it could work. Because a lot of our clients, a lot of our neighbors that went out there also got connected to services while they were there. So it was a really nice thing to see, and it reinforced why we need a low barrier shelter here in Indianapolis.
I just want to add to what you asked. We chose our location, which is literally right next to Horizon House, for a reason. One, we had to get support to build. That's a big piece of this. But also we're partnering with Inglewood Development Corporation, which is literally right down the street from Horizon House and is an East Side development corporation that is really, like most of the people who work at Inglewood live within walking distance to where they work. So being part of that community was really important to them. So, and it's right on a bus line, which is super helpful for resources. That's all I wanted to add.
So that NIMBYism, I'll come over, is real. People want solutions. They just don't want to see them or have them be in their neighborhood. So as we talk about ways you can go out there and advocate and have these conversations, that's a big one, right? Like people say, we want to have solutions to those living downtown unsheltered, and we want to see more access to these things, but I don't want it in my area. And so as much as you can combat that kind of like not in my backyard stuff, which is real, some of these pipeline projects have faced that pretty heavily. And so that neighborhood engagement is really, really important, but having voices at that table that understand the issue and understand that it's all incumbent upon us to be part of that solution becomes pretty vital.
This administration and City County Council passed for this budget of 2022 that $12 million was set aside for this low barrier shelter. Whatever that means next is where these funds will go to, right? So the initial assessment was, does Indianapolis need a low barrier shelter? It's conclusively come back as yes. We'll wait on the state to see what their assessment reveals. But the next step is to figure out those things. How is it going to be funded long term? Who's going to run it? Are we, why would it be okay for the city to run it versus a private organization to run it? Like, we need to have those community conversations. Where is it going to be? What services are going to be provided? What kind of beds are going to be available? And making sure that the organizations that have been working in this area are also at the table to make sure that they are being heard, because it takes a joint effort for this type of work. Recovery houses are typically with DOC, and we focus on Marion County. However, I will give you a contact at DOC. We just had a really great conversation yesterday with a partner at DOC to help with the reentry efforts and getting those individuals connected to jobs and resources through OPHS's connections. So I can get you that information. As far as what a recovery house is, it's definitely education. I'm hoping people just have an open mind, right? Those who are in recovery houses usually have a parole officer around, a probation officer. They cannot do drugs. They cannot own firearms. There's a lot of restrictions, right? So there's not going to be a drug dealer in the front of the recovery house. They won't be able to get funds if that's the case. So that's something, is just misinformation and getting people educated and open minds. Yeah. So I think I can give you that connection with parole. Making sure that they're engaged in asking those questions to the right people is critical. So I appreciate that question. As far as your second point of information, so I believe it's in July, 988 is going to be rolled out. And I don't know if you're familiar with 988, but it's a number that will be used hopefully instead of 911. To help those who are going through some type of emergency crisis that is not criminal, right? A lot of it mental health, substance abuse, right? And so there's that. Then during the normal business hours, 9 to 5, and I believe 10 to 7 p.m., we have the MCAT unit here in Marion County, the Mobile Crisis Assessment Team, who goes out to those situations and talks to that individual. So it's made up of a team of not only an officer, because sometimes those situations can become dangerous, but those officers are trained. They are crisis intervention trained, and they also come with a clinician or a social worker. So that way they can respond as a whole and get that individual connected to the right resources. And a lot of our officers are being crisis intervention trained so that way they can recognize. And the mayor made an announcement, I believe 2 weeks ago now, where MCAT is going to be supplemented with a social work team. So that way there'll be a team of social workers that, if a call comes in that somebody's in the lobby and they're sleeping on the ground, or they're being, they're acting different, then that team can go out there and try to intervene and see what it is that's going on and get to the root cause and not arrest them or take them to jail.
And Lillian, I don't know if you can share, I know staffing has been an issue in the sector, particularly during COVID, yes. But we also have phenomenal street outreach teams that work in our agencies. Horizon House has some dedicated street outreach folks, as well as adult and child, who typically know most of the people that are living unsheltered and have built those relationships. And so that's another, I don't know who the best contact right now, but it's professional blended street outreach. There's a whole network of outreach workers and staff that can respond as well.
And if I may really quickly brag on Horizon House for a second, there is the Housing to Recovery Fund. And I want to say Horizon House used Housing to Recovery Fund money to meet its goal of helping 120 households maintain housing for a year. And with that, they found a 73% reduction in Marion County jail stays. So it works. Mm-hmm. It works. And it works all over. So I just wanted to brag.
So, just piggybacking off of your first thing, be a human. So in that moment, if you encounter another human being, have a human experience with them. So I'm not saying don't give somebody $1 or don't give somebody a cup of coffee or a sandwich. That's a human thing to do. That's not the solution. That's not going to end their homelessness, but it's a very compassionate thing. So I wouldn't discourage that. Get to know people and have that human experience. But if you're out there in your networks and in the places that you have influence and can advocate, I think the first thing is to educate people and try as much as possible to break down some of the misconceptions and the stereotypes and to teach people what's going on and why people experience homelessness and dispel some of those myths. I think the other thing is continuing advocacy in whatever ways you can, whether that's at the local level or the state level, for more affordable housing. We have to get more affordable housing. We have to have stronger tenant protections and tenant rights. Here in Indiana, we have some of the highest eviction rates in the country. That needs to be changed, and that requires policy change and lots of voices coming together. And get to know the organizations out doing this work and ask them, what do you need to continue doing this work? I think that's an important thing too. And there are ways you can get involved. Like, I look around this room and I'm like, board members, who wants to serve on boards? Who wants to help influence this work and bring your expertise and leadership to this work? So those are some of the ways you can get involved. Be a human, advocate, educate, and get engaged with these organizations. Andy?
Ditto. Yeah, it took it. Tenants' rights. Indiana is one of the worst states in the country for providing basic human rights to renters. That's a state issue. I think there's some things we could get creative at the local level. So I encourage you to ask your elected officials and other folks that work within the city government to strengthen, just to try something to fight back against the state kind of oppressive policies. Ask for more dollars for affordable housing. Housing is one of the best ways to address a lot of societal issues. Educational attainment for kids, employment efficiency, employment, folks keeping employment. It addresses poverty. If somebody if their rent is $300 less, and that's $300 more a month that they have, that's a lot of money a year. So we need more money for affordable housing. The other adjectives around that: affordable housing, permanently affordable housing, affordable housing for very low-income people. Push the attainability and the accessibility down lower.
Well, double ditto. But I would add that education is huge. I think Chelsea hit the nail on the head. I think as you were asking, well, I don't know, right? People don't know. That's something that's major, right? But I'm going to go, I guess, towards more of the root causes and getting to know those individuals, but also dedicating your time to just volunteering in these areas. Then you'll get to see really what the issues are. Sometimes you might not understand that a lot of people have jobs that are homeless. And so if you guys can advocate for more employers to pay livable wages, I think that's a step in a right direction. Getting employers to accept those who have criminal histories. That is something that's huge, a huge barrier to get people housing, especially rentals. So making sure that those individuals have an open mind when it comes to these issues. And then I guess just loving each other, right? I will tell you, it makes a huge difference if you have a conversation with somebody on the sidewalk who may be homeless or who may be facing homelessness. And then that can motivate them to go out and continue trying, right? A lot of these people lose hope and they believe that people don't care about them. And so I'm all about showing people love. So that's mine.
Triple ditto. The only thing I'll just add is very similar, which is if you don't have time to stop and talk to somebody, eye contact goes a long way. Don't pretend like there's a really awesome quote from one of my favorite musicians, but don't just walk by someone without acknowledging their presence. I think that's a really big one. And interrupt things that your friends or family are saying that might be off. Just say, hey, I don't know. Let's talk about that a little more. That might not be right. Is really important as well.